answer two questions. I hope you don't mind. So my first question would be, what's your opinion? So you're faced with a patient or you're faced with a colleague. What do you tell them about nasal packing? You very eloquently told us what happens in individual hospitals. You've obviously done a lot of research into this. I'd like to know what your thoughts are.
So I think it also kind of depends on the patient. If it's like a very anxious patient, because some patients you kind of know beforehand whether there's bleeding afterwards. So you might like take the extra precaution and like put in the extra money and use an absorbable pack for that patient. So I would do it more on an individual basis. Yeah. Also, like according with the model, like Stern Scheibe and this group suggested that you don't do it like on average or like on everyone, but like if the chances are less that you think there's less synergia, you don't pack.
And in terms of extensive operation, so if you do a minor operation,
Mm-hmm.
like a simple polypectomy with no real damage to the nasal mucosa.
Yeah, I think I wouldn't pack.
And if you do a much more extensive procedure, maybe with a lot of bleeding,
Yeah, yeah, yeah.
Okay.
Also, if there's like diffuse bleeding at the end, even though you have coagulated, I would like put the pack.
And you very eloquently went through all the literature, the existing literature on packing and not packing, and you alluded to the fact that more studies were required.
Yeah, biggest.
If you were to design a study yourself,
Yeah.
and I appreciate you alluded to the fact that you'd like it to be a multi-center study. How would you design that study?
Well, the thing is, there's quite a lot of heterogeneity, like also in the data. So the different kind of dates when they looked at the post-operative care, the different packs which were used. Should try and make it more compare the same with the same. Yeah. No, we don't at all. No. The question was like, because some authors propose that you don't need packing because you can just like suture the middle turbinate to the septum, get rid of the whole process, uncinatus, and like have enough space so that you don't need a pack. And the question was whether we do it in our practice. We don't in a hospital. Pardon? Sorry?
Do you have any tricks to easier the removal of the pack?
Any?
When you remove the pack, make
Top tips.
Oh, so. So what we usually do, I don't know whether you do it, like we put an ice pack usually for half an hour in the neck of the before we remove it. Let the patient. We often like so. In our clinic, we go to the bed of the patient, so he is actually in bed. He's sitting upright with a pack for half an hour. Then we remove it. We usually say like breathe in, breathe out, and on breathing out we remove the pack. That's how we do it.
Any further questions? Oh, please take the microphone.
Actually, one question, kind of one suggestion. So because you put emphasis on discomfort for the patient after removal of packings, so my personal experience is that the best thing that probably relieves the patient out of their discomfort is just using some borderline ice cold saline, but just a minor amount during removal of the packing. The only complication I've had so far is something like a minor ice cream headache for some of the patients, but really relieves the pain. And my actual question is, because nobody mentioned that, for how long would you suggest, that's to all the speakers actually, for how long would you suggest follow-up visits, considering we have a patient with some regular type functional endoscopic sinus surgery, not some malignancy, of course, that you have long follow-up. So how many subsequent visits would you suggest to make sure that we have no complications?
That's fine. I'll just to clarify that question. So it's how many follow-up visits to get the patient to recovery?
Or what period of time would you suggest?
Okay, for a standard phase case. So, Dr. Speth, first of all.
So we do it also on an individual basis. So we usually have the surgery, like in 1 week after surgery, we see the patient, and then we do then anterior rhinoscopy and see what it's like, and also whether the patient. So even if it's like good looking, and the patient is very anxious, we see him or her again.
Well, we start at day 8 or 10, then after 2 weeks, and then 4 weeks, and then 6 weeks and 3 months. But it depends on nasal polyposis. Sometimes we may have some recurrence earlier, and so first 10 days, 2 weeks after later, and then 4 weeks.
Okay.
And then after for polyposis, we check for 1 year follow-up every 3 months, and then we think, okay, 1 or 2 visits per year for the 5 following years.
Okay. Is Dr. Albu still here?
Yes.
Yes. Would you like to give us your opinion?
Real life is different from guidelines. So one thing is to have the optimum care for that patient, but it depends on the compliance, because in the theory we would like to follow these guidelines, but it depends on the individual patient. So we rely on the doctors from the territory, because we are a tertiary referral center. We are doing the surgery, and our colleagues from the outpatient clinic, they do follow the patient as has been stated, in 1 week, 3 weeks, 1 month, 3 months, 6 months, on a regular basis. When we have polyp patients, we have correspondence with them either by emails or WhatsApp calls, and we follow especially the disappearance of the smell. And this is the sign of recurrence, and we are prone to follow actively those patients who do lose their smell.
Okay, sort of symptom-based follow-up. Yeah. Okay. Let's have a show of hands. We're all amongst friends here, so you can give an honest answer without feeling embarrassed. In terms of follow-up, who would follow their patients up for more than a year? Okay, and who would follow their patients up for 6 months, say? Okay, who would only follow up for a month? And who doesn't follow up at all? Okay, so we have quite a difference of opinion. I think, again, reflecting some of the inconsistencies in the literature, and also differences in our sort of healthcare systems that we work in. Any other questions for our speakers?
Just one remark. I think that because of the COVID, we have to do consultation by phone. And I don't agree exactly with this, because we have seen some patients, regular patients, and they came because they had some problem, but they do not come to the clinic. And so you see that the disease evolves slowly, but surely. So I think that, of course, if you are very confident in your patient, you can follow up by phone just because of the symptoms. But you can see also for polyposis that the polyposis recurs very silently, and maybe at that time you can change your therapy.
Yeah.
So maybe a nice follow-up, not necessarily 3 months, but it's necessary to check the evolution, because we know that nasal polyposis is very chronic.
Okay, ladies and gentlemen, I think we've come to the end of our session. I'd like to thank the speakers in our traditional way and give them a round of applause. And you get an early start to join the queue for lunch. Thank you very much indeed.